So what would you say to clinicians who are unsure about whether or not they should try ACTIVA BioACTIVE in their practices?
First of all, we need to find what are the reasons why they are scared. And it's easy. You just have to test it. I cannot make you trust a material if you don't try it. So what I can say is that you have to trust the key opinion leaders. We are ethical clinicians, and we are happy with the product. So from a dentist to a dentist, my advice is try it. If you like it, use it. If you don't like it, you don't use it. But you have to try it. I am 100% sure that you will stay with the material. Believe me, I live in a little country, and the profit of the clinic is way bigger now with ACTIVA. And what I'm observing after 3 or 4 years of using ACTIVA is that there are no margin leakage after this time. So please try it. It's for your own benefit and the benefit of your patients.
So you mentioned that after 3 or 4 years, you are not seeing any marginal leakage.
Yeah.
What else are you noticing in recall appointments 6 months, 1 year, multiple years after that first ACTIVA placement?
Well, what I am observing is that the margins are intact. And sometimes, as you know, even in the first control appointment, you can start observing little leakage with other composites. Obviously, this has to be fixed, and it has to be fixed for free. So if you don't have this type of problems, if you don't have to repeat any restoration, then you will not lose money. And obviously, it's a health issue. If there's a margin leaking, it will go on leaking. So you better fix it the same day you find it, but you will lose money. Mm-hmm.